Are you looking to increase your treatment plan case acceptance rate? In today's Dental Boss TV, I'll discuss the little known ways to do just that. Hey Dental Boss, Anissa here, the founder of Delivering Well and the Dental Boss movement, and I'm here every single week with a new episode of Dental Boss TV showing dentists just like you how to start and run a successful dental business so that you can start attracting and serving more patients you love. Subscribe to my channel and hit the bell to be notified when I post a new video on Dental Boss TV right here each and every Tuesday. Accepting treatment is a huge decision for any patient, especially when high-value procedures are involved. One of the things a lot of dentists overlook are the words we use when presenting treatment. In fact, you can immediately improve case acceptance by avoiding these 4 simple words. Maybe. When presenting a treatment plan that involves making patients healthier, it's important that you let them know what you see, why you're concerned, and the real risk of doing nothing. Imagine you're at a dermatologist and after examining your skin, the doctor tells you they're worried about a mole and they want to remove it. Most people would be less likely to cut it off if they said, maybe we should remove this mole. If instead they said, we need to remove this mole, I am extremely concerned, now you will move into action to get the procedure done. Patients come to us because they trust us to be open and honest. Oftentimes, however, many of us fear a patient saying that they're not ready, which leads to a lack of confidence. But remember, you're the expert and you've got this. Cost. Tip number 2 is to avoid saying the word cost to a patient when discussing treatment. For example, if you tell a patient that getting an implant is going to cost them $5,000 and leave it at that, they will immediately think of how much money they have in the bank. If they don't have $5,000 in the bank or a credit card with a high available credit that they're willing to tap into, they're less likely to move forward. When presenting treatment, focus on providing 3 payment options and let them know how other patients just like them are able to fit dentistry into their budgets. By the way, I talk more about this in my past episode, how to present a treatment plan the right way. Word number 3, cheap. When you tell people something is cheap, they're either going to think of one or 2 things. The first is that if it's cheap, it's low cost. The second is if it's cheap, it's low quality. Instead, say this is a good value. When someone tells you something is affordable or a good value, it comes across as being low cost, but without the negative connotation of it being cheap. For example, you might say the real value is you'll be able to eat what you want. You won't have to remove your dentures anymore. And you'll be able to avoid large expenses that come from your teeth shifting or future bone loss. Reminding patients of the value of your treatment plan and the outcomes they will receive helps them better appreciate the benefits of moving forward with your treatment plan. And the last word, problem. Problems feel big to patients and big feels expensive. So instead of saying the problem with your tooth is, you might say there's an issue with the tooth in the bottom right of your mouth that requires, and then present your treatment plan to the patient. Your patient is much less likely to push back when you present the real issue rather than a problem. Consistent case acceptance can make or break your practice. Word choice might seem like a nuance that doesn't amount to much, but patients are much more likely to move forward with treatment plans when you avoid these 4 simple words. Now you know why focusing on verbal skills is important to your success. Tell me in the comments below, what was your biggest takeaway? Now that you've gained clarity on the things to focus on with case acceptance, it's time to hone in on exactly what you will do next. If you haven't taken advantage of my free case acceptance framework checklist, check out the link below. And if you're ready to join a community of dental bosses just like you, I have a Facebook group where dentists come together for support and action-taking tips and motivation. And as always, if you like this video, please let me know by liking it below, subscribe, and share it with your fellow dental bosses. And make sure to check out the video below to learn how to present a treatment plan the right way.